Thank you very much, Chairman Miller. Madam Speaker, our leader, my colleagues, Chairman Waxman, Chairman Rangel, and our leader, Mr. Hoyer. I am proud indeed to be here with my great colleagues who have worked so hard on this undertaking. And I'm delighted to be a participant in this great undertaking. As mentioned, this is the first time we have gotten to this point. We're going to cover every American. We're going to see to it that they have choice. We're going to see to it that not only are the humanitarian concerns of people with regard to health care met, but that an economic calamity which is coming, unless we do so, will be headed off because of the work that has been done today. This is a good bill. It is a uniquely American solution to address the insecurities in health care felt by the American people. The burden of cost of health care has been placed on the economy, and the competitive disadvantages experienced by our businesses will be removed. Today, it marks a major step in this long journey of ours. However, it is not the last step. And while we greet this day with delight, we know that we have a lot of work before us. My old dad would be pleased. He started this out in 1943 with Harry Truman, and we have been working on it ever since. And Madam Speaker, I want to tell you how pleased we are that we can finally say the House is going to consider this and that we are going to pass it. And I look forward to working with my colleagues in the caucus and the larger House of Representatives to solving the greatest single humanitarian and health care problem that's faced by our people. This nation has a proud history of protecting our elders, our newborns, our sick, and those who are the weakest and least capable of taking care of themselves. We created Social Security during a time of economic calamity. We passed Medicare legislation during a period of civil unrest and a divisive war. Some of our greatest acts of compassion have come at the most difficult and trying of moments. We are working to accomplish something that is greater than us as members of Congress, and something which must, should, and I hope will transcend partisan divides and bickering. This has been tried by many presidents and Congresses before. However, this time is different. This time we will be successful. This time we must be successful. This American solution of ours will help those needing care gain access to the finest medical care in the world. And there's an interesting thing about this country. We have the finest medical care, but a lot of our people can't afford it and don't get it. We're going to cure that. Not only do we have a chance to do the right thing for and about our people, but also for our economy. The high cost of health care is not only a part of today's economic woes, but it will cause a still greater problem in the years to come. Because if you draw on the line, you draw on the graph two lines, the first being the cost of medical care and the second the gross domestic product, the two of them will cross sometime around 2070 or 2080. We have an opportunity then to prevent the next great economic catastrophe, but we must learn from the current economic crisis that we've inherited. To protect the health and the well-being of our citizens in our country and our help to our businesses to remain competitive, we must be bold, we must be strong, and we must respond to the challenge that we have before us and that we are confronted with now on behalf of our nation's citizens. And we have to address the problem, cure it, and pass this legislation now. I'm proud to be a part of it. And And I have the privilege of introducing the great majority leader who is going to lead us in that undertaking, Mr. Hoyer.